In this lecture, we're going to look at acid-base homeostasis. Now, the pH of arterial blood ranges from about 7.35 to 7.45, and the mechanisms that maintain this range are going to be buffer systems, exhalation of carbon dioxide, and kidney excretion of hydrogen. And one of those buffer systems is the protein buffer system. It's the most abundant in intracellular fluid and blood plasma. And when pH rises, in other words, it gets more base or alkaline, the carboxyl group is going to dissociate to act like an acid. And so you can see right here the carboxyl group, and then it dissociates to act more like a carboxylic acid, for instance. When pH falls, in other words, the blood is becoming more acid because, again, acidity is measured by the amount of hydrogen ions there are. And pH is actually an inverse log, so the smaller the number, the more hydrogen ions there are. So it says when pH falls, the free amino acid group dissociates to act like a base. And so you can see here we have our NH2, and what that'll do is pick up this excess hydrogen to give us a plus NH3. Now, hemoglobin in red blood cell also acts as a buffer. Now, what we're going to look at here is going to take place inside the red blood cell. And these would be red blood cells heading off toward tissue that has already used up its oxygen. It's giving off carbon dioxide. And one thing that you want to remember is that the more carbon dioxide there is in the blood, the more acid it is. And you're saying, well, wait a second. I thought the slide before you talked about the more hydrogen ions there are, the more acid it is. Where's the hydrogen ions? Well, if we take H2O, water, plus the CO2 that's entering the red blood cell here, we're going to get H2CO3, and that's carbonic acid. By the way, there is an enzyme here. We abbreviate it as Ca. It's carbonic anhydrase. So, but anyway, this is carbonic acid. So now it's going to be a bit more acid inside the cell. And now the carbonic acid is going to dissociate into hydrogen ion and bicarbonate ions. Now, like I said, this is going to be toward tissue that, or going past tissue that's already used up the oxygen. And oxygen is bound to the hemoglobin. Remember the red blood cells? The blood is going to go to the lungs, get rid of carbon dioxide, pick up oxygen. Well, it's going to be bound with oxygen. We call it oxyhemoglobin. Now, since there's a lot of hydrogen now from the dissociation of this carbonic acid in the red blood cell, the red blood cell, the hemoglobin, is going to release the oxygen, and that's going to go off to tissue, and it's going to take up that hydrogen. We say this is reduced hemoglobin. Okay? So one more time, this red blood cell, which has oxyhemoglobin in it, is going to go by tissue. It's going to pick up some carbon dioxide, combine that carbon dioxide with water, give us carbonic acid. Carbonic acid dissociates into hydrogen ions, making, again, this is what we measure for acidity, and bicarbonate ion. So then the oxyhemoglobin is going to give up its oxygen, take on this hydrogen, and now we have reduced hemoglobin, and the oxygen can then leave the red blood cell and go to tissue where it's needed. Let's take a look at the carbonic acid bicarbonate buffer system, and this is based on bicarbonate ion, which acts as a weak base. And carbonic acid, H2CO3, acts as a weak acid. And so we see here that we have hydrogen ion. Again, this is acidic. We have bicarbonate ion, which is a weak base. We combine those, and now we've buffered down that pH by creating carbonic acid. Okay, we've reduced the amount of acid, which actually increases the pH. Remember, the higher the pH, the more basic it is. The lower the pH, the more acid it is, with 7 being in the middle as neutral. Okay, so if the pH falls, bicarbonate ion removes the excess hydrogen ions. Again, to form that carbonic acid and to make it a little more alkaline or base. Now, if the pH rises, in other words, now the blood is becoming more basic or alkaline, carbonic acid can provide hydrogen. And again, it's going to do that by dissociating or breaking apart, and now we have hydrogen ions to help lower the pH or make it more acid, and then free bicarbonate ion. Let's take a look at the phosphate buffer system. This system acts similarly to carbonic acid bicarbonate buffer system, but here we have dihydrogen phosphate and monohydrogen phosphate, and these are the ions that are going to be used in this system here. So here we have a hydroxide ion, which is a strong base. We have dihydrogen phosphate, which is a weak acid. Combine those, and through a chemical reaction, we get water. And actually, that chemical reaction would be a dehydration synthesis, where water is removed. And we wind up with this monohydrogen phosphate, which is a weak base. Okay? So again, with homeostasis, we're trying to maintain a balance. We don't want strong acids. We don't want strong bases or alkalis. Okay, so we're trying to shift more toward neutral. And even though that this is a base, it's a weak base compared to this hydroxide ion. And so let's look at the other way now. We have dihydrogen phosphate, monohydrogen phosphate, and these are going to be the ions used in this system. And here, the monohydrogen phosphate is going to act as a weak base. So we have hydrogen, which again is a strong acid. We have the monohydrogen phosphate, which is a weak base, and that's going to yield dihydrogen phosphate, which is a weak acid. Okay, so now this is going to correct when the system is too basic. We're going to try to, again, bring the acidity, we're going to lower the acidity and try to bring it back toward neutral. Now, exhalation of carbon dioxide, CO2 is going to mix with water in the blood, again, to form carbonic acid, H2CO3. Exhaling CO2 leads to less acid production and a rise in pH, whereas retaining CO2 leads to more acid production and a drop in pH. And CO2 plus H2O is going to yield H2CO3, carbonic acid, and dissociates in the fluid or in the blood as hydrogen ions and bicarbonate ions. Okay, so the blood is acid. Another way to remove hydrogen is through the kidneys. Excreting hydrogen in the urine removes non-volatile acids. The proximal convoluted tubule and the collecting ducts of the kidneys secrete hydrogen into the tubular fluid. And if we look at this picture right here, we can see here's the CO2. We bring that in with water. Here's that carbonic anhydrase I mentioned earlier. That's going to give us H2CO3, carbonic acid, which dissociates into hydrogen and bicarbonate ion. That hydrogen here then it's going to get pumped through active transport through this proton pump into the fluid in the tubule lumen and becomes part of the urine, and you urinate that out. The bicarbonate, we have a chloride shift here where chloride's going to come in. Bicarb is going to go out, okay, through this antiporter here. And that excess bicarb is then going to be absorbed into the peritubular capillary. Also, some of the hydrogen secreted into the tubular fluid in the collecting duct is going to be buffered by HPO4 and NH3. HPO4, hydrogen phosphate, NH3, ammonia. Okay, so it could be buffered that way. And the buffers are excreted then in the urine as well. And now let's look at mechanisms that maintain the pH of body fluids. Again, the mechanism, we have buffer systems. Most consist of a weak acid and its salt, which functions as a weak base. They prevent drastic changes in body fluid pH. We have proteins, most abundant buffers in the body and blood. Hemoglobin inside red blood cells is a good buffer, as we mentioned earlier. Carbonic acid, bicarbonate, important regulator of blood pH, the most abundant buffer in extracellular fluid, and phosphates, which are important buffers in extracellular fluid and urine. Exhalation of CO2, with increased exhalation of CO2, pH rises. In other words, it becomes more alkaline. With a decreased exhalation of CO2, CO2 rises in the bloodstream and pH falls. In other words, it becomes more acid. Kidneys, the renal tubules, secrete hydrogen into the urine and reabsorb bicarbonate ion so it is not lost in the urine. Now, acid-base imbalances. Acidosis is blood pH is below 7.35. Alkalosis, the blood pH is above 7.45. Respiratory acidosis, blood drops due to excessive retention of CO2, leading to excess carbonic acid. Again, we look at the CO2 to know if it's a respiratory acidosis or alkalosis. We look at bicarb to know if it's a metabolic acidosis or alkalosis. Okay, so a respiratory alkalosis, the blood rises due to excessive loss of CO2. For instance, if you hyperventilate, you're going to blow off a lot of excess CO2. The blood's going to become more alkaline, okay, or basic. Metabolic acidosis, the arterial blood levels of carbonic acid falls. Okay, because again, bicarbonate ion is your buffer, and if those levels fall, okay, due to whatever, you're going to become more acidic. You're not going to have that bicarb to buffer that those hydrogen ions. And metabolic alkalosis, the arterial blood levels of bicarbonate ion rises. Let's take a look at a summary of acidosis and alkalosis. With respiratory acidosis, we have an increased PCO2 above 45. Now, PCO2 is a measurement we take when we do a blood gas, an arterial blood gas. We look at arterial blood, and that PCO2 should be between 35 and 45 millimeters of mercury pressure. And decreased pH below 7.35. Remember, normal pH of arterial blood is 7.35 to 7.45. Again, this is arterial blood. It's going to be different with blood that has already given up its oxygen that we would draw from a vein. Okay? And so what causes this? Hypoventilation due to emphysema, pulmonary edema, trauma to the respiratory centers, airway obstruction, or dysfunction of the muscles of respiration. Compensatory mechanisms, the kidney can compensate for this. It's going to increase excretion of the hydrogen, so you're going to pour out, or pee out, I should say, more hydrogen, right? And increase the reabsorption of bicarbonate ions. If compensation is complete, pH will be in normal range, but the PCO2 will still be high. It's just compensated now. Respiratory alkalosis, we have a decreased PCO2 below 35 millimeters of mercury and an increased pH, so it's going to be above 7.45 if there is no compensation. What can cause this? Hypoventilation due to oxygen deficiency, pulmonary disease, cerebrovascular accidents, CVAs, that's a stroke, or severe anxiety. In other words, you're hyperventilating. Now, this could be compensated again by the kidneys, decreased excretion of hydrogen, decreased reabsorption of bicarbonate. If compensation is complete, pH will be within the normal range, but PCO2 will be low. Metabolic acidosis, we have decreased bicarbonate, which is going to be below 22 millimeters or milliequivalents per liter. And again, the normal range is between 22 to 26 milliequivalents per liter for bicarbonate ion, and decreased pH below 7.35 if there's no compensation. Causes loss of bicarbonate ion due to diarrhea, accumulation of acid, ketosis, and renal dysfunction. So as far as the ketosis goes, like in diabetic, ketoacidosis is what we're talking about right here. Compensatory mechanisms, respiratory, we have hyperventilation, which increases the loss of CO2. If compensation is complete, pH will be within the normal range, but the bicarbonate will be low. Okay, so the bicarbonate's low, and what the body does is you will start to hyperventilate, trying to get rid of excess carbon dioxide to again buffer that that loss of the CO2 or the HCO3. I mean. Okay, metabolic alkalosis, increased bicarbonate ion above 26 milliequivalents per liter, and increased pH above 7.45 if there's no compensation. Causes are going to be loss of acid due to vomiting, gastric suctioning, or use of certain diuretics, excessive intake of alkaline drugs. Okay, those can lead to metabolic alkalosis. Compensation, respiratory, you're going to have hypoventilation, which slows the loss of CO2. If compensation is complete, pH will be within normal range, but bicarbonate ion will still be high. Okay, aging with fluid electrolyte and acid-base homeostasis, significant differences exist between adults and infants with respect to fluid distribution, regulation of fluid and electrolyte balance, and acid-base homeostasis. Factors that influence distribution is metabolic rate, functional development of the kidneys, body surface area, breathing rates, and ion concentrations. Older adults often have impaired ability to maintain fluid, electrolyte, and acid-base balance. Older adults also suffer from dehydration, hypernatremia, in other words, salt levels are too high in the blood, hypokalemia, phosphate levels are too low in the blood, and acidosis.